So after avoiding hip replacement surgery for such a good number of years, you decided to move forward. What triggered that change for you?
You know, Donna, here I am, an alternative physician, an integrative cardiologist. I write newsletters, I'm on radio, I'm on TV, I give lectures, and now I come down with a hip that's degenerative. And I said to myself, if I can fix somebody's heart and take somebody who needs a heart transplant back to normal, why can't I fix my own hip? It made sense to me. And I tried. I mean, I took nutritional supplements, I did Pilates, I did stretching exercises, I meditated, I did Tai Chi, I did yoga, I did everything. I had stem cell therapy, I had my own blood injected into, and my own platelets injected into my hip. I inhaled glucosamine because it gets into the bloodstream. I've done it all. And it was around Memorial Day weekend. I was with my grandson. I was walking to the Memorial Day parade, and my hip locked, and I couldn't move. And I'm saying, uh-oh, it's time to have the surgery. So I flicked a switch, called my surgeon, and I said, I'm ready. He says, come on down. He put me on the schedule in 2 weeks, and I had it.
And you're glad you did?
I'm glad I did, yeah.
Well, it's an interesting role reversal. You're the doctor and not the patient. So how has this experience affected the way you deal with people seeking your advice about hip replacement surgery or other types of surgery?
Well, you know, being a cardiologist, I recommended bypass surgery to hundreds of people, maybe even 1,000 people. I was an invasive cardiologist for years, did thousands of heart catheterizations. And when people were dreadfully afraid of surgery, at first I was a little bit, hard. I was insensitive. And I said, but it's life-saving, you gotta have it. I mean, I had people with unstable angina, which means they have chest pressure at rest, and they needed surgery urgently. Now, I'm more sensitive to their needs. If they can wait to have surgery, if they can wait and delay it, and they can develop a mental fortitude where they have to go in with a strong positive intention, not fear. When you go into surgery with fear, the unthinkable could happen. But when you go into a surgery, I need it, I want it, like I did, with positive intention, then good outcomes occur. So I used to block surgery years ago when I had patients who were dreadfully afraid. As long as they weren't having, active angina or, progressive symptoms, which would help to literally prevent sudden death if they had the surgery.
Did you ever have those moments of fear yourself before you went into the surgery?
The first time I made an appointment in December, I did. I said, I had one of my wrestling buddies from high school, went in for elective surgery. He was 2 years younger than me for his shoulder, and he had a stroke, and he was a healthy guy like I was. And I know that every surgery, there's a risk. I mean, there's no such thing as elective surgery. Elective surgery carries risk. I don't care what the anesthesia is. When it's general anesthesia, when they put you to sleep, it carries risk. I fortunately had spinal anesthesia. That's what I wanted, and I was happy with that. But I prepared so well mentally, physically, emotionally, and spiritually for my surgery. I had no fear.
Tell us what you did. Tell us about that preparation on those 3 levels, mentally, spiritually, and emotionally. What three or four things did you do in each of those areas to really help you prepare for this surgery that you think other people might benefit from?
All right, let's take physical first. Physical, I was eating organic foods, lots of fresh fruits and vegetables, lots of fiber. I wanted to get my GI tract working really good. I didn't drink any wine or alcohol for like 3 weeks before the surgery. Wanted to give my liver, I wanted to give it a chance to be as healthy as possible. Certainly no sweets, no high fructose corn syrup. I don't do that anyway. I prepared to the point where I felt so good that I was feeding my body proper nutrition and my liver was healthy to handle spinal anesthesia or any of the drugs they gave you, that I felt so good about it. My GI tract was working with 50 grams of fiber per day. I was steaming broccoli, cauliflower, and Brussels sprouts. I call it the trifecta of getting your GI tract moving. So, and I took vitamins and minerals. I took, my usual stuff, my CoQ10, my carnitine, my ribose, magnesium, my multivite. So in my mind, I built my physical body up nutritionally with, supplements, with foods. Then I did Pilates exercise. I did stretching. I toned my muscles up because remember they dislocate your hip. When they saw off the head of your femur. And I knew this. So I prepared my body physically. And I just went in with the mental. Now we'll get into the second piece, mental. I went in with the mental mindset. I was like Jack Nicklaus visualizing a golf shot going down the fairway. But this is the way I did it. I was listening to tapes. And in the tapes, the voice would say, imagine your surgical team being there for you, being the best there is. The nurses, the doctors, the anesthesiologists, there for you. And they are going to assist you into becoming well. And everything is going to come out wonderful. So in other words, I planned my surgery. I planned my healing before I had my surgery.
Is that what you call guided imagery? Or
guided imagery, yes, exactly. So I would listen to tapes at night, and it would program my mind. So that was the mental aspect. Then the spiritual aspect was basically I meditated, I prayed, and I gave myself positive intention. I said, you need this surgery. It's time for the surgery. And I went in with positive intention. If I had any fear come into my mind, I got it out. If I heard a little voice talking, I said, no, I don't want to hear you. I'm going into this with positive intention, and I am going to get well. And what I did for help was I got acupuncture. I had my meridians, checked to make sure there was no blocked energy in the body. I also did Reiki. I saw Reiki masters.
Hands-on healing?
The hands-on. I even had Reiki in a hospital one day following surgery. So I really set up a group of professionals that when I went into this, I went into it 100%, and I was on a fast track. You know what that means?
No, tell us.
I went in on a Wednesday morning at 5, had the surgery at 9, walked at 1 o'clock, 4 hours after surgery, and then went home 2 days later. I spent 2 nights in the hospital and went home. And the first thing I did when I went home...
So you're the poster child for hip replacement surgery.
Quick. Yeah, I had a quick recovery. And then when I went home, I took my shirt off, I took my shoes off, and I just put my bare feet in the ground, and I soaked up all this vitamin D. And I said to myself, it's going to be clear sailing from here on. And it was. It was a breeze.
So you really set yourself up to be successful for this surgery in a big way.
Absolutely. It's a positive mindset going in. And just knowing, you have to have a deep knowing everything is going to be okay.
What about the surgeon? How did you go about choosing the surgeon? Because that seems like a pretty important piece to all of this as well.
Yeah, Donna, I went to the Hospital of Special Surgery in New York. I went to Waterbury Hospital. I saw great surgeons. I wouldn't let anyone operate on me. But the last surgeon I had, I got another opinion, and I liked his bedside manner. Plus, he was a martial arts expert. And I said to him, I said, Steve, had the same name as me. I said, Steve, I may decide to have the surgery, but would you give me permission to cancel it, if I didn't want it, even if it was a week before? He goes, look, when you're ready, you're ready. So I had canceled it twice beforehand, and, he gave me that permission. So I needed to work with somebody who could work with my pace. And I had him screened. I had some of my mental, spiritual advisors look at him, and they said, you picked him, but he's fussier than you are. So the fact that he picked you, he knows that you were a good surgical candidate. And I found out afterwards. I found out that he doesn't like to work on very, very obese people, for example, because they have more complications. And I even said to him, I said, look, if you want me to lose 5 or 10 pounds for this surgery, I'll do it. He says, no, it's not necessary. But, I screened him well, and I would tell our listeners that don't choose any surgeon. Ask your friends, ask your doctor, ask your relatives, ask nurses in the hospital, who would you go to for a surgeon? And if it feels right in your gut, then proceed with the surgery.
Sounds like you really had a partnership with this doctor, right?
Oh, gosh.
It was a two-way communication. Your needs, what he wanted to do, and so forth. It wasn't the traditional, he was going to tell you exactly what to do, and you do it. Is that right?
I do it, exactly. He was in charge, but I said to him, Steve, you think I can go skiing in a year? He goes, absolutely, why not? Mm-hmm. And that's what I wanted to hear, He even put 2 screws in my hip, to hold it in, and I'm looking forward to going skiing again.
Mm-hmm. When will that be?
See, I had the hip surgery in June, so I'm going into my 5th month. Mm-hmm. So maybe December of next year.
That's not pushing it?
Oh, no. I was thinking this March, I really was, but that might be pushing
That's
it.
that power of positive thinking.
Yeah.